Today's program, Wi-Fi, cell towers, and smart meters, oh my, does man-made microwave radiation impact human health, is coordinated by Kathy Eugene and Marty Wilde. Our speakers are physics professor Davison Soper and Eugene physician Paul Dart. Dr. Dart earned his MD at the Mayo Medical School in Rochester, Minnesota in 1984. His full-time practice in Eugene offers allergy and environmental medicine. Dr. Dart reviewed hundreds of articles in current medical literature as part of the medical advisory group consulting with eWeb about the potential risks of wireless smart meter technology. Please join me in welcoming first Davison Soper and then Paul Dart to the podium.
Good afternoon. Cellular phones, cordless phones, Wi-Fi routers, baby monitors, smart meters, all these devices transmit on the microwave radio frequency bandwidths. In the United States, the guidelines for maximum intensity of exposure to microwave radiation are established by the Federal Communications Commission. Now we know that high levels of microwave exposure can heat things up. The FCC's guidelines for microwave RF exposure are only designed to protect the public against its thermal effects. And the FCC makes no assurances whatsoever that these guidelines protect the public from other non-thermal biological effects. When these FCC limits for microwave RF exposure were published back in 1999, not that much was known about these non-thermal effects. So are there biological effects of microwave RF exposure that aren't caused by heat? The government panels and commissions that say RF is safe usually sidestep this question. If you read them, you'll find they say that if exposures are within the FCC guidelines, they can't cause heat damage. And they'll say that not enough is known about other biological effects to draw conclusions about their risks. Now, in my presentation, I'm going to discuss a few examples of the recent research findings about biological effects of this to give you a feeling of what is currently known about it in the recent literature. First, let's look at evidence that RF exposures can produce acute symptoms, a problem called electro-hypersensitivity syndrome, or EHS. Russian scientists learned that microwave RF could produce acute symptoms back in the 1950s. They called it microwave syndrome. This is one reason that the Russian limits for RF exposure are 1/100th of the United States FCC guidelines. Russian researchers described a constellation of symptoms including headache, ocular dysfunction, fatigue, dizziness, sleep disorders, dermatographism, cardiovascular abnormalities, depression, irritability, and memory impairment, and called it microwave syndrome. In the years between 1953 and 1978, the Russian government harassed the staff at the U.S. Embassy in Moscow by targeting the office with radiation from a microwave transmitter positioned on the roof of the next building. Exposure levels inside the building were less than 1/20th of the FCC guidelines, but people developed symptoms, and the government funded an epidemiologic study. A doctor from Johns Hopkins came and studied this and found a statistically significant excess of several problems in these workers, including depression, irritability, difficulty in concentrating, memory loss, ear problems, skin problems, vascular problems, and some other health problems. In 2003, researchers in Spain published a study that looked at symptoms of microwave syndrome in a town of 1,900 inhabitants where a GSM cell phone tower had been placed in the middle of the town. They compared frequency of symptoms in Area A, less than 150 meters from the tower, versus Area B, greater than 250 meters from the tower. And they measured the power density of the signal in the subject's bedrooms. In Area A, the average level of exposure in the bedroom was less than 1/1000th of the FCC guidelines. In Area B, exposure levels were 10 times lower than that. And what they found was people in Area A had statistically significantly higher levels of discomfort, sleep disturbance, depression, poor concentration, dizziness, fatigue, irritability, headache, nausea, and appetite loss. In 2002, a study was published by French researchers that evaluated the incidence of symptoms of microwave syndrome in relation to residential proximity in meters to a cell phone tower. They found that people who lived closer to towers had significantly higher incidence of various health complaints, including fatigue, irritability, headache, sleep disturbance, depression, memory loss. In 2008 and 2010, Danish researchers published 2 studies that looked at the health status of over 13,000 7-year-old children that have been followed since birth at the Danish National Birth Cohort. And they found that children with a history of prenatal and postnatal cell phone exposure in the home, where cell phones are being used in the home, had a significantly increased incidence of emotional problems, hyperactivity, conduct problems, and peer problems as compared to unexposed controls. Now, public exposure to microwave transmissions has increased dramatically in the last 15 years. A 2011 study in France found that exposure levels in urban areas were 600 times higher than they had been in the year 2000. Here in Oregon, we're now in the process of putting Wi-Fi into all of our schools and many of our homes and public spaces. Wi-Fi routers transmit constantly, whether or not they are transmitting data to the computers in the network. If you could hear your Wi-Fi router and hear the pattern that the transmission makes, it would sound like this 24 hours a day. With this recent and dramatic increase in exposure to wireless signals in our society, the incidence of what we now call electro-hypersensitivity syndrome, or EHS, is increasing. Public awareness of the problem of EHS isn't very high yet, and it's hard to know how many people have symptoms from these exposures but are unaware of the cause and effect relationship. But you can do research surveys to identify the percentage of a population who identify themselves as being electrosensitive. Studies performed over the last 20 years in Europe and the United States show that this number appears to be increasing. In 1996, 2 or 3% of studied populations in Austria and the United States reported having this problem. By 2005, this number was approaching 10%, and it continues to increase, apparently. Now I'm going to turn to a discussion of evidence demonstrating that microwave RF can cause damage to DNA. In 2010, researchers in India published a study measuring DNA fragmentation in the brains of rats who were exposed to RF in a microwave level. In this study, exposure was 2 hours a day for 35 days at 1/3 of the FCC exposure limits. And the evidence showed that exposed animals had significantly increased levels of DNA damage in their brain tissue. At the same time, they found that their brains had significantly reduced levels of antioxidants, evidence that increased oxidant stress due to excess free radical production might be related to this DNA damage. Over the last 5 years, this kind of finding has been replicated in multiple studies at multiple research labs using lower and lower levels of exposure to RF. If you want to find it with a lower exposure, you run the study out longer, and you'll find the same effect. Now, in India in 2014, a similar study was done looking at DNA damage in human beings. The subjects were randomly selected healthy individuals living within 300 meters of a cell phone tower. And they looked at fragmentation of DNA in the white blood cells and compared that to white blood cells in normal, healthy controls who lived much farther away from towers. And what they found was evidence of significantly increased levels of fragmentation of DNA in the people living near to the towers. What they did then was they took the control group that lived in areas with no nearby cell phone towers, with ambient exposure levels less than 1/100th of the FCC guidelines, and they compared blood samples in that group between people who used cell phones and people who didn't, and found higher levels of fragmented DNA in the cell phone users' white blood cells. Now, chronic exposures that damage DNA can have severe health consequences, including cancer and reduced fertility. Multiple epidemiologic studies have shown a relationship between microwave exposure and cancer. In a study published in 2008, researchers looked at a case control group of cancer patients living within 1,200 meters of a cell phone tower between 1984 and 1997 in a town in Austria. RF exposure levels at the exterior of their residence were measured. The researchers found a significant increase in cancer risk at exposure levels greater than 100 microwatts per meter squared. Now, the FCC thermal safety limit is 6 million microwatts per meter squared. In the highest exposure category, breast cancer risk was 23 times higher, and brain cancer risk was 121 times higher. Belo Horizonte is the capital of a state in Brazil with a population of 2.25 million people. In 2011, a study was published. Researchers looked at the relationship with residential proximity to cell towers and cancer. In 2006, there were 856 cell phone towers in the city. And what the researchers did, they mapped the location of every cell phone tower in the city. They used health department records to locate the residence of all individuals who have died of cancer in the city between 1996 and 2006. And this allowed them to calculate the distance in meters between the deceased individual's residences and the closest cell phone tower. And then they crunched the data, did the math, and this is what they found. Cancer death rates increased with residential proximity to cell towers. At 500 meters, this increased risk was statistically significant, and at closer distances, it was even higher. Now I want to talk about fertility. Increased oxidative stress and DNA damage can reduce fertility. Multiple recent studies have shown that microwave RF can have this effect in insects, birds, animals, and human beings. A research study published in 2008 looked at 361 men at a fertility clinic. The researchers evaluated sperm quality in these men as a function of their daily cell phone talk time. With greater than 2 hours a day of reported talk time, which is the red line on this diagram, they found a statistically significant reduction in sperm count, motility, viability, and normal morphology. And this was even a greater change with greater than 4 hours a day of talk time. In 2009, another research group exposed sperm to cell phone signals for 16 hours under isothermal conditions. They kept at the same temperature, so they knew heat wasn't an issue. Exposed sperm had significantly lower vitality and worse motility, with increased free radical levels in sperm cells. In 2012, another research group looked at the effects of Wi-Fi transmission on human sperm. Motile sperm in semen was incubated at room temperature, 3 centimeters lap distance below a laptop computer that was transmitting. And after 4 hours of exposure, at a level 1,000 times less than the FCC exposure limit, this is what they found. Significantly fewer motile sperm, more immobile sperm, and increased fragmentation of sperm DNA. Now I'm going to look at what the actual evidence is linking cell phones with brain tumors. First, we'll talk about data from the Interphone study. This study was funded by industry, and the first results were published in 2010. The authors' published conclusions included the statement that overall no increased risk in glioma or meningioma was observed with the use of mobile phones. And that statement from the conclusions has been quoted in the media ever since. But in this study, regular use was defined as a minimum of 1 call per week for at least 6 months. Half the subjects in this study had less than 115 hours of lifetime exposure. And if you look at the published data, you'll find that the risk of brain tumor is not increased in 9/10 of the subjects. But individuals with greater than 1,640 lifetime hours of cell phone use showed a significantly increased risk of glioma brain tumor. Subjects with that level of exposure or above had roughly twice the risk of glioma on the side of the head where they habitually held their cell phone, compared to matched controls. And for acoustic neuroma, this risk was 3.5 times higher. The most recent data from the Interphone study was published in 2011, and they showed that cell phone users in the highest exposure study cohort had roughly twice the risk of glioma and meningioma. At this point, the authors said that this appeared to be a finding, but it needed to be confirmed with more studies, even though it was actually a confirmation of their earlier study. And these findings have also been confirmed by the Hardell Group in Sweden, which is not funded by industry and has found increased risk of brain tumor in cell phone users in multiple studies, and has said so. Their data also looks at risk with in-home cordless phones. This summary of their data shows that with greater than 2,000 lifetime hours of use, cell phones triple the risk of brain cancer, and in-home cordless phones more than double that risk. The Hardell's group, their research found that a significantly higher overall risk existed in younger users. For example, individuals who start using a cell phone as children or teenagers have roughly 5 times the risk of developing an astrocytoma compared to non-users. This is over 3 times greater risk than is found in individuals who start using a wireless phone at age 20 or above. And it makes sense because younger people have thinner skulls, so the bones provide less shielding of the brain tissue. Another study published in France in 2014 has found similar overall results for cell phone use in the top decile of their subject exposures. In that cohort, the people that had the most exposure, greater than 15 hours a month created 4 times the risk. Greater than 896 lifetime hours created almost 3 times the risk. Greater than 18,360 calls created over twice the risk. Now, numerous research studies published over the last 10 years or more have shown that microwave RF increases free radicals in living cells, and that this damages DNA in the cells. Dr. Soper talked about the physics of the electromagnetic spectrum. And at the top of the end of that, we have gamma rays and X-rays, very high energy signals that can directly break DNA molecular bonds, causing mutations. Microwaves do not have enough energy to directly break covalent molecular bonds. And industry representatives often say that the effect of an electromagnetic exposure must be proportional to the strength of that exposure. And because microwave RF can't directly break molecular bonds, there's no way that it can cause cancer. That's essentially what Dr. Soper said to you earlier this afternoon. And this is good physics, but it reflects a very poor understanding of cancer biology. There are many ways to cause cancer besides ionizing radiation. Inhaled tobacco smoke causes lung cancer. Inhaled asbestos causes lung cancer. Chewing tobacco causes oral cancer. Chronic H. pylori infections cause stomach cancer. Genital warts cause cervical cancer. All these agents produce chronic inflammation in the target tissues. The chronic inflammation produces the cancer. Current research suggests that chronic microwave RF exposure has a similar effect, producing chronic inflammation by increasing the production of free radicals in the tissues. These free radicals then damage DNA, which can lead to cancer. In all these cases, the damage is not determined by the force of the external stimulus. It's determined by the chronic inflammatory response of the organism to that stimulus. Now, in 20 minutes, I only have time to scratch the surface of this subject. A thorough overview of the current literature might take 60 minutes or more. I'd be surprised if I presented enough evidence to convince you of what I'm saying. But if all I've done is made you wonder, oh my, could this actually be true? Then I've achieved my goal here. If you want to learn more about this subject, download the testimony I presented to the Oregon Senate Committee on Healthcare and Human Services on December 8th, 2014, and the submissions by Martin Paul, PhD, on mechanisms of how these free radical inflammatory processes occur. To find this, Google Paul Dart MD 12/8/2014. Paul Dart MD 12/8/2014, and follow the link to the Oregon Legislative Information System and to the meeting materials from that meeting. A link to this testimony can also be found on the website friendsofamazoncreek.org. All one word, friendsofamazoncreek.org. Thank you.